Hello and welcome to today's Wired Briefing, Connected Health and Care, Accelerating Inclusion Through Innovation. I'm Greg Williams, Editor-in-Chief of Wired UK, and I'm delighted that you could join us today. In today's briefing, we'll be exploring the future of connected healthcare and how we can harness new technology in order to create an inclusive and patient-centric healthcare system. The pandemic laid bare many of the social challenges the UK faces, and as the world begins to open up, it's now crucial that healthcare continues to innovate to ensure that high quality care is accessible to everyone. To share some of their key learnings from the past 18 months, I'm delighted to be joined by Danny Kelly, the Innovation Director of Vodafone Business, and Shafi Ahmed, the teacher, futurist, innovator, entrepreneur, and award-winning cancer surgeon at the Royal London Hospital. Danny, Shafi, welcome. Great to have you with us today.
Hi, Greg.
I'd like to start with probably the most important aspect of this discussion, really, which is about patient outcomes, because that's fundamentally what we really want to care about. So, Shafi, let me start with you. There have been studies that demonstrate that doctors spend more time on their computers than working with patients. So just as a starting point, it'd be great to get a sense from you of what the experience is like from a doctor's perspective, working with technology on the front line in the healthcare system. How can we improve it?
So that's a great question to start off with from the kind of the clinical perspective and the frontline example. So if you go pre-pandemic, and in fact, during the pandemic, if you look at how we negotiate seeing a patient in the outpatients at a hospital setting, for example, we spend the time going into the hospital, switching on the computers, waiting for the computers to interact and connect with the radiology services, the pathology services, and the electronic health record boots up. And it all takes time. Sometimes it can be very frustrating, Greg, maybe 10, 15, 20 minutes. You get a cup of tea and you wait, and then you see the patients. And of course, all the consultation, the data that you acquire is back inserted into the EHR, electronic health record, which takes time. So when I remember a few years ago, I did a little work with my medical students, I asked them to just time me how much time I actually spent engaging with the patient face-to-face. It was only a third of the time, actually. So that could change. That whole experience for both patient and the clinician could be much better in terms of speed of work and technology. Having said that, we've now come through the pandemic. Now we're seeing more technology being used, telemedicine, teleconsults, more electronic work, for example, more data being shared across the piece. So now we have to be even better at managing that conversation and to ensure we don't erode our connection, our collaboration with that patient. That's obviously the most important part of any consultation, is that direct relationship that you have with them. So we have seen a change. We've seen technology now being used much more openly. People are now more supportive of it. We've seen more implementation, and we've seen the general change in the language of people accepting technology as part and parcel of the future of the health service.
Yeah, I think that's a big difference. And we're clearly seeing an acceptance that things have changed, things have moved forward. Danny, when you hear Shafi's experience, you hear him talk about what it's like to be on the front line. Just thinking from a connectivity perspective, what do you think are some of the steps that we can take to mitigate some of the challenges that clinicians face?
I mean, it's fascinating to hear Shafi talk about that. A third of his time is spent with patients, and 2/3 is probably lost in the quagmire of IT systems and IT stack. So it talks to me about opportunity, Greg. There's a massive opportunity now for us to help make the NHS more efficient, to give Shafi time back, that he can spend consulting with patients and really changing patient outcomes. And that starts with the digitization of hospitals, and whether that's the IT stack and the IT systems, or the applications that are used internally for communication, the security wrap that we put around those, and then of course, as you rightly say, Greg, the connectivity. So look, there's a lot of things that we can now bring as a result of new age technologies, 5G connectivity, MEC edge compute. There's a lot of things that we can now deliver to really help transform and digitize hospitals. But I would say this, Greg, before we even get to that point, I think the NHS has an opportunity there's a little bit of catch up to do versus private sector from public sector. And I think there's a lot of lessons that can be learned from the private sector that we can pull into the public sector and start just looking at, what is the IT stack? How do these systems and processes work? This doesn't happen in the private sector, so how can we support it in the public sector? Once we start to resolve those challenges, we can then get quite, experimental in terms of what does connectivity allow us to do. And Shafi mentioned it, throughout the pandemic there, we've seen a change in terms of the willingness to adopt new ways of doing things, both on a patient side and within the hospitals themselves. So it's an interesting time we're in. I think we've got all of the tools in the toolbox. We now just need to work out what do we do first.
And clearly the NHS has got to be one of the biggest, if not the biggest, purchasers of IT in the UK. What role do you think procurement maybe has in this?
Well, look, it's procurement's front and center, so it's super important. I think what we find is actually typically with the innovation on the innovation front, that we are looking at new technology adoption for example, augmented reality assisted surgery, or something kind of quite innovative and cutting edge. You tend to find the physicians, the clinical users are actually at the front edge, and they are the driving force within hospitals. And almost, similar to, external parties attempting to sell in, an element of frustration there, so there's a very much a pull from clinicians, not necessarily understood by procurement teams who have worked, in the old school principles around, procuring from frameworks and buying, IT stacks and whatever it may be. I think when we start to move into the true world of innovation, actually no one supplier has all the answers. It starts to be a bit more creative in terms of how we can deliver solutions across applications and compute power and network connectivity. And you have to bring all of that together to deliver true innovation. Now, that is something that's absolutely happening today in the private sector. I would go as far as to say, actually, you just have to look across the Atlantic, where they've got a very different healthcare provision system. It's very much private. And you can see the adoption of new innovation because they don't have the similar constraints, I suppose, albeit those things have served the NHS well. But I think we have to have a rethink around how do we really deliver true innovation into the NHS? And there's an element of catch up that has to be happened. And then after the catch up, then how do we layer on real value?
Right. So we hear a lot, Shafi, about how technology in healthcare industry should be used in a so-called patient-centric way. I used that phrase in the intro. I'm really interested to get your perspective from the perspective of a clinician. How do you think about patient centricity? That very idea.
Yeah, no, I think that's a fundamental question as we go forward. And one thing that's come clear from the pandemic, Greg, is that the patients are actually more tech savvy than we ever gave them credit for. And actually, think about the past where we were asking patients to come to a clinic, spending time from home, from work, etc. It was not a great experience. Now we're using this term of patient experience, user experience almost, in healthcare, which I never thought would happen for a long time. But now look at this. They have now access to telemedicine, so they can access doctors immediately with their timings, at their beck and call almost, saying, look, we are more empowered by accessing information on the apps, NHS app, become more digital, and accessing doctors on a telemedicine platform. So we've almost empowered patients to become more digital. Also said to them, actually, that will improve your experience in accessing healthcare immediately at your request almost, rather than the hospital or primary care being the center of health. It's actually your home now. So as we moved on with us being on Zoom calls and having meetings remotely, we see that remote coming in. So I think that whole, now we're going to be driven by the patient experience and agenda. Are we going to say, are you happy with this experience? Are you happy with the access to healthcare? Are you getting the right treatment? As we go forward, as we connect more and more things, actually, we'll be managing more and more remote conditions remotely, Greg. We know that 70% of the NHS budget supposedly goes to managing chronic conditions. That's a sizable budget. So the question for now is, now that we are more remote, how do we manage remote conditions better, like diabetes, like asthma, COPD, and others that take a huge brunt of the budget of the NHS? Can we be smarter? Can we use the patients in that fold? Can we ask them the right questions, doing pilots remotely, managing remotely, using maybe data analysis and metrics to ensure they still get quality treatment, and then ensuring that they are used remotely? And that requires validation, Greg. It requires data, research, trials, validation, to ensure we're not creating a digital divide, which I'm sure we'll talk later on, to ensure the quality remains the same despite moving care outside the conventional method of treatment. And what it is, it's smart healthcare, Greg. It's smart. That's the key word for us to use.
Yeah. Sorry, Shafi, to interrupt there. I really wanted to touch on that idea, though, of making sure that we begin to close this digital divide. And so maybe I'd love you both to talk about this, but maybe Danny, first of all, just thinking about from the technology side. Obviously, we talk about innovation. We talk about ways in which we can introduce technology to improve patient outcomes and to make efficiencies and but to have real impact in the world. How do we keep that part of things moving forward so that we are innovating, but also how do we kind of like backfill the challenges that we know that we've seen from the pandemic, that there's these massive inequalities and people without access to the internet or digital skills, who aren't maybe able to access healthcare in the way that many others are. How do you think we can start dealing with that particular challenge?
Greg, I think the business case writes itself. I mean, Shafi just quoted a brilliant stat here: 70% of the NHS's budgets are dealing with chronic illnesses, right? So those repeatable illnesses. So how do we effectively begin to deliver services outside of the hospital? How do we decentralize healthcare? How do we push that either into the community or into the home? Now, it does lead to the challenge around digital divide, but we'll come to that. I think what Shafi talked about there in terms of customer experience and expectations. What we've definitely seen through the pandemic is the genie is now out the bottle. We've probably all had some form of kind of telephone conversation or with our GPs or doctors, and it was massively convenient, right? No time off work. I dialed into a Zoom call, we had a quick chat, and it's done and dusted. The expectation now is it's the reverse. We used to think patients wouldn't accept that. Now, actually, the expectations from patients is that they want that level of convenience. So patients are willing to accept a different way of accessing their healthcare, and therefore, I don't think in this millennial generation, that we will have pushback from that. So there's an opportunity for us to begin to think, okay, from a business case level, how do we then begin to effectively consider how we decentralize healthcare? How do we take out the cost of the NHS to make it more efficient, and effectively allow people, by the way, to get their lives back? Patients with chronic illnesses don't want to be going to the hospital for diabetes checkups. Not now, when we've got the likes of IoT, the Internet of Things, where we can capture patient data, we can aggregate that, collate it, and we can send it securely to a GP, and effectively only see the patients that we need to see. These are step changes, small step changes that we can do and affect today, and we have a willingness out there now. Post-pandemic, we have a willingness with the with patients who are willing to accept new ways of accessing their medical services. The challenge, as you rightly point out, however, is the digital divide. So if there is a business case that says we're going to take X amount of million out of the NHS, or actually over years, and what does that look like? The way in which we're going to do that is to push those services elsewhere. It's maybe in the community, it's maybe under the individual, right? So in terms of IoT, or it's actually into the home. So therefore, we've got to step back and say, how does that individual, how do all individuals get a kind of ubiquitous holistic coverage? Doesn't matter where you are on the divide. And I think if that's the case, we've got to begin to consider connectivity in the round as a utility. Broadband connectivity, is that a utility as much and a right as much as water is? And not for everybody here, Greg. I'm not advocating that everybody should have free broadband, certainly not. But actually, where we do have a divide in the community, where people are potentially on job seekers or benefits and actually don't have means or access to that, but yet we still want to push government services, centralized services into the home and into the community. We have to consider, how do we do that? It's very much like all of our employers in the private sector, who effectively told us all to go and work from home, and it was very quickly employees were saying, well, I don't have the right access or means, I don't have, a table and chair. These are basic challenges that people face into, so we have to step and understand, okay, if we want to take something that's centralized and decentralize that, how do we ensure that the provision of that is equal for all?
And one, I guess, the key aspects of decentralization is the flow of data, right? The flow of data throughout the healthcare system. So I'd love to touch on data next, and I've got different questions for each of you. Shafi, first, if I come to you, if you don't mind. Clearly, any large organization, and there's very few organizations as large as the NHS, one of the big challenges is silos developing. So, information not flowing, data not flowing to places where it's needed, where it's crucial. How do you think about the ways in which we can improve data sharing, knowledge sharing between clinicians?
I think that's a really good and topical conversation now that the government is trying to persuade primary care to collect data on all individuals by 2021. So I think it's the right conversation to have, Greg. I think it's about, first of all, to make it work, you have to engage, you have to be honest and be transparent to the patients. There's no question, they are the most important part of this conversation of how do you bring out that data and share that data fairly. We're going to be living in a data-driven world, there's no question. We want to be personalized care. We want to see kind of precision care. We want to make sure that each individual gets treatment that they need to improve their outcomes. And that's only done by data. So at the moment, we have been in silos. Data has not been shared as well as it could do across all the healthcare systems. And we're talking about hospitals, primary care, social care, community care, and also, of course, universities and academic research institutions. How does that whole ecosystem work better? Because that data is so valuable from a population health perspective. In fact, in terms of COVID pandemic, we're seeing how population health is benefiting from large-scale data acquisition, from genetics, looking at people's genomes, for example, in the future, how we collect that data, as well as personalized data from the medical records. We've seen attempts from the NHS and NHSX producing the NHS app, which now allows you to look at your own data from your primary care, arrange appointments, share your data, for example. And I was seeing now this kind of more seamless way of sharing data through that healthcare system. There's still a problem with interoperability. There's still issues of silo, still issues where data isn't kept as well. We are getting better, Greg. And the other problem we have is standardization. If you look at technologies like AI and others, you have to have good, clean data, which you can then use for other technological ambitions, whether it's AI or whatever it is. So not only does data have to be collected, you have to have the right kind of data, tagged the right way for use downstream. So still a lot of issues, but I'm glad to say that we are better at now thinking about data. The only problem we're having is that conversation piece, Greg, with our patients, saying, look, we want to capture the data. How do we do it? How do we work with you? And that's what I'm seeing missing, Greg. It's almost like people are fearful of what patients might say in return. I said, don't be fearful. They're very pragmatic. They will want to help us and ensure that the data helps other people make better decisions about their illnesses. So I'd say that's the key for us going forward. Next 3 or 4 months, we need to have that conversation openly and honestly and work out the issues around data sharing, monetization. It's a crucial question to ask people, and then to come to some arrangement where everyone agrees in principle how we go forward. But that's a challenge, Greg.
Right. Yeah. So Danny, Shafi touched some of the challenges there. Obviously, a major challenge with patient data and privacy are ransomware attacks from malicious actors. We're seeing an increase in this. There was an attack on the healthcare system in Ireland, and we've seen it elsewhere as well. From your perspective, how do we ensure that free flow of data throughout the healthcare system, while also ensuring security and privacy for patients?
Yeah, I think we're living in a world of cloud now, Greg. So actually the hyperscalers, major investment in security around their data and data protection. So whether it's Google Cloud, Amazon Cloud, there's lots of clouds, IBM Cloud. They've got the means and the capability to provide a multi-cloud type environment where we can effectively access data in a secure fashion. The role of the network operators, of course, is to ensure that the connectivity between that is also secure, and that's where the power of 5G networks, for example, Greg's comes in. No 5G or no mobile network has ever been hacked. So if I, for example, in a centralized environment, at a hospital, provided a 5G network to enable the clinicians to share patient data and patient records freely around the hospital whilst they're connected to that network, then effectively they can do so in a very secure and safe manner. The single challenge that the NHS faces around patient data security today is probably the most effective means of sharing information is WhatsApp. It's shadow IT. Shadow IT is a major problem in every industry, right? Shadow IT, whether it's a private sector or public sector, shadow IT is a challenge. The private sector is probably just accepted that WhatsApp seems to be the de facto communication tool, but that's not appropriate in healthcare. But what we certainly can do is ensure that we can wrap effectively security around the communications network within those environments to ensure that they're completely secure, so you can access the patient records in the cloud, access the patient records around the site, and do so in a secure manner. It wasn't that long ago that we had WannaCry in the UK, where the NHS was attacked, but actually There was an element of it, because it was a lot of it was still done on paper and pen. Actually, they were saved probably versus what could have happened, you know. And I think actually we've got to play forward and understand, okay, what if that happens in the future when we're fully digitized? How do we actually put in the right security mechanisms? How do we put in the right security around the data to give our patients effectively some sort of understanding that data will be, if they've give that data across to us, that data will be protected.
Yeah. So we've seen that there are multiple technologies now that are available today. Shafi, you've demonstrated them, you know, consistently with your amazing work around augmented reality and other forms of technology. However, we are also, you know, we've been discussing dealing with an enormous, highly complex system. Shafi, maybe if I can come to you first on this with the question. How do you think we can best layer in or map these new technologies onto where we are now and drive things forward incrementally? Because, you know, there's clearly not going to be a kind of like a big bang scenario where suddenly, you know, 1 week we flick a switch and, you know, the healthcare system's, you know, fully changed and fully augmented. How do you think we want to just move forward these incremental steps that are going to be so important?
Yeah, so I think we're quite lucky in 2021, Greg, because we have a richness of technologies that just weren't available 10 years ago.
Yeah.
And there's a whole plethora, as you know, whether it's immersive tech, this AI, nanobiotech, the 5G IoT that Danny's been mentioning, etc. I mean, we can talk endlessly about the amount of technology, but of course you can't just force it all at the same time. How do you make it work going forward? So first of all, I think you have to build a workforce that's ready for innovation. So you build innovation to the heart of the organization. So they understand change, they understand how to implement and translate some of those ideas and showcase validation, etc. At the moment, we have been working in silos, small pockets of innovation, which have been amazing in primary care, secondary care, but haven't had the, I guess, system in place where we approach it on a national level, top-bottom approach. So actually, this is great. How do we disseminate that good information and the right results going forward? So that's part of the conversation. I'd say that it's exciting. You have the early inventors, innovators who should be encouraged constantly. And they need to bring the other people, the other 99% of the workforce on that same journey. Say, look, how about innovation? What can you do in your own work, your own specific area of work to ensure that we move on and we innovate? How do you build that into an organization? You look at industry like Google, they give 1/3 of their time to the employees to think outside the box, to innovate. That's where Gmail come from, for example. How do we do the same thing in healthcare? We haven't. These are the lessons to be learned from industry partners. And the idea as we go forward, Greg, is collaboration. We've seen in the last 18 months, industry come forward to help us support, drive this COVID kind of response. We've seen a much closer alliance. We've seen that we can't do it all on our own as healthcare workers or healthcare systems. Can we bring partners like Vodafone and others, say, look, what are the solutions? How do you do things? How do we move on? So I think it's collaboration, it's understanding, building the concept of innovation across the system to ensure that some of these ideas gain traction. But it's a not immediate approach. It's going to be medium to long term as we start implementing change going forward.
Danny, both you and Shafi have referenced the fact that, you know, one of the things the pandemic did reveal was obviously this massive kind of inequality in the system and the fragility that exists in some areas of it. How do you think we can build in more resilience or build in resilience from both a technology perspective and also, I guess, Shafi, I'm interested in getting your thoughts from a clinician's perspective. So Danny first, maybe, you know, resilience, how do we build it in from a kind of a technology perspective?
Expand on that, what you mean, Greg. So, but resilience in what aspect?
Well, just resilient, making the system function in ways that mean that it's not going to, you know, parts of it will collapse. So, you know, we saw, you know, during the pandemic that, for instance, you know, PPE we couldn't get access to, so there was a supply chain challenge there. I'm thinking kind of like broadly around the idea of resilience and making it tougher, making sure there aren't these points of weakness. Yeah,
I mean, look, so Greg, I come at it from a networks perspective. Look, we're in a, Shafi mentioned that we're in a super cool era now. You know, it's 2021. We actually have all the recipes for success in terms of delivering true innovation across the whole of the NHS and begin to plug a lot of gaps. We probably never had all the component parts before, but now if I look at it, we have 4G, 5G, IoT networks on one hand. So if you think of this like a Venn diagram, Greg, and on the other hand, we have computing where? Computing on premise, in the cloud, on the device, actually now at the edge of the network. So actually you get this option around computing power. So why is that important? It means when we combine the compute power with the technology access, we can start to do things in real time. We have information in real time, and we have real time data. And what's great about that is that means that there's third parties who can build applications that can take advantage of that network attribute and the edge compute attribute to really deliver true innovation. That for me, it's about starting with the problem statement, Greg. There's lots of things that we can do. We can talk about, digitizing hospitals, delivering 5G into hospitals, delivering 5G into the community. There's lots of innovation around augmented reality, virtual reality, robotics, AI. All of these things, of course, can be done. And of course, we're involved in proof of concepts, Vodafone across the whole of Europe, in projects delivering exactly that. But Greg, actually it will only deliver true value. We can only deliver real value if we can nationalize the service, if we can actually bring it out and offer it at a national level. And how do we do that? We have to narrow in on those pain points. What are the specific pain points and how do we address them? How do we address the challenges? So for example, I'm talking to Health Trust at the minute, Greg, and they've had a very transparent conversation with me that their big challenge is actually getting patients out of beds in hospital spaces to free up beds so that we can bring more patients in. How do we do that? How do we leverage technology to do that? That's a challenge back to me and I suppose the peers in our industry, which is what technology can we bring that will support the NHS and effectively freeing up hospital beds? That's a major challenge that's affecting every hospital across the country. If we can get that right once in a proof of concept in a particular hospital trust and demonstrate that, bring together the data for that, and then effectively raise that through means of NHSX or NHS Digital, our government contacts, then effectively we can begin to really find new innovative ways with new technology across 5G, IoT, broadband connectivity. It doesn't really matter. We're not precious on the connectivity, but the point is, if innovation is going to happen and it's going to happen at scale, it will only be effective if we really focus in on the outcomes and work our way backwards. So what's the problem statement? What's the outcome we want to achieve? Let's work our way backwards. And we build the technology around that. So for me, Greg, that's really at the heart of what we need to do here.
Okay, great. Thanks, Danny. I've just realised we actually have got time, but we haven't got a huge amount of time left, so we should probably move on to some of the questions that are in the Q&A, and let's look at some of the ones that have been upvoted. There's one from Sophia, and probably this is one for you, Danny. The question is, can you explain the IT stack and the difference between public and private sector, which is compromising efficiency? So I guess the efficiency within the public sector.
Yeah, absolutely. I mean, the private sector moves very quickly. It doesn't have the burden the NHS has, which is absolutely vast by way of an organisation. It's the single biggest employer in the UK. So they're vast and they're spread, and they've got different ways and means of purchasing. But effectively, if we look at the private sector and look at the IT stack, we were very quick to move to the cloud. Recognise that the data, the efficiencies we could have by having an Azure cloud and an Amazon cloud, and moving our workloads into the cloud and accessing that data remotely. Aggregating data from the cloud and accessing that from an IT perspective, leveraging things like Teams. Here we're using Zoom today. These are tools that have been in the private sector for quite some time, but less so in the public sector. Less so in not necessarily public sector, but in the NHS. Shafi made the reference at the point at the start of the call. His systems and his legacy IT stack is so slow. That's because it's trying to access information that's stored locally on some device or server somewhere that isn't being managed in the most appropriate way. We've now got things like software-defined networking that can really address those challenges. How can we make that data real time? That should never be the case with 5G networks and software-defined networks. We can effectively make the IT systems run a lot slicker, a lot smoother, and given access then to the likes of Shafi, who can then spend more time with patients. So it's around taking the availability of the technology that now exists, and we've had a massive step forward in the past 5 years around all of the technology that does exist that can really transform frontline healthcare.
Great, thank you, Danny. So Shafi, I think probably the next question is for you. It's from David, and the question is, how much is culture a component of some of the challenges around technology innovation and implementation, do you think, in the healthcare system?
Thanks, David, for that question. And I think it's quite pertinent to ask that. I think culture has a huge, problem in the NHS. We're very historical. We do things from historical legacy. We do things we're comfortable with. We don't want change. And that's been part of the problem, Greg. that we don't want to change our ways or our thoughts or processes. So to challenge that, of course, again, I said before, bring innovation to the heart of the organization to encourage different ways of thinking is, I think, the main part. How do you bring nurses, doctors, physiotherapists, healthcare workers all together and say, look, we have brand new ideas of changing and making different ways of working. Can you help us, support us? So I think it's that conversation piece. Having said that, the last 18 months, we have seen a change of culture. We have seen more adoption, more translational ideas with technology innovation that have now become part and parcel of the healthcare system. So I think there's still much work to be done, but it's still, from a leadership perspective, this is why I hold the leadership accountable, is how do you persuade your workforce to engage, to adopt and to translate new ways of working and new ideas to help their patients. So that's going to be the challenge for the future CEOs in hospitals and the NHS England.
Great, thanks, Shafi. Next question is from Melinda, and it's around digital solutions to reduce NHS waiting lists. Obviously, we're seeing kind of record waiting lists for many operations at the moment. Are you seeing any kind of innovative ideas on how we can use technology to mitigate this?
Absolutely, Greg. I'll go first. I mean, I noticed a story I was reading just recently about guys in St Thomas's. They've just been lent another Da Vinci machine that allows them to address the cancer patient waiting list that they have for tumor removal. They can get through another 300 patients this year because of access to that particular device. So it's a very physical implementation there that will really help address that. But Vodafone have been involved in a number of projects, and we just recently done one with in Cardiff, connecting 2 hospitals, 2 sets of operating theatres. We're deploying a solution from Proximity Healthcare, which is effectively an augmented reality, virtual reality assisted surgery tool, which allows surgeons to prepare for surgery, perform the surgery with augmented reality, with access to surgeons from anywhere in the world. And that effectively really does help reduce those cancer patient waiting lists. Why? Because it means that surgeons no longer need to scrub in to do surgery only once or twice in a day, but actually can become the consultants and effectively virtually scrub in to 5, 6, 7, 8 surgeries in a day. And we can tap into that from anywhere in the world. So this is now just not having access to surgeons who are just available in Cardiff, but further afield. And what else is we can also use that for training now, Greg. So through the pandemic, we can get student doctors into the operating theatres to observe, but actually we can now do that virtually. So it's about how do we retrain, how do we train people to get through the academies to come back into the healthcare system, how do we provide them the tools. So here in this case, augmented reality, virtual reality assisted surgery, it uses AI as well. So there's lots of things that we can begin to do now with taking those great applications that can take advantage of both the 5G networks and the compute power that deliver true innovation. But like I say, Greg, it has to be part of the problem statement. So what problem are we trying to address? And then let's work backwards and work with the technology after that. So if that's a particular problem, we can find solutions for it. I'm pretty confident today within the NHS, whether it's care in the community, remote patient monitoring, it's whether it's cancer patient waiting lists, there's lots of options, not just the one I've described, that we can deliver. It's just a case of understanding what are the component parts and how do we deliver it.
Just one final question from Matt. Shafi, maybe this is one for you. We talked a lot about seeing patient care and people in hospitals and how we can implement technology in order to better the outcomes. Matt wants to know, how do we use tech to keep people out of hospital? Any thoughts on that?
Hi, Matt, and thanks for the question. Thanks for joining us on this wide event with Vodafone. I think that's the key. As we alluded to at the beginning, a lot of expense is around building the infrastructure of the NHS, secondary care. Actually, we need to move people into the community. We know that from the data that's come out of the pandemic. We know there's been a huge inequality to health there, Greg, from social care not being supported and care in the community not being supported enough. Patients don't want to come to hospital. Let's face it, who wants to come to hospital for a few days, especially in the pandemic? So how do we keep them out of hospital? Well, first of all, we use the data to ensure that we allow the healthcare system to be proportioned in terms of the budget appropriately. So spend more money in community care, social care, rather than secondary care. We work on prevention, well-being, health, maintaining wealth, maintaining those chronic diseases at home, hypertension, COPD, diabetes, giving the data to the patient to empower themselves to manage their health better. We see that more and more. We see NHSX rolling out some pilots now, looking at some of these chronic diseases, but remotely using some technology. It could be a simple, look at diabetics, Greg. We're now using, for type 1, we're using the kind of the Libra system, putting little electro implant into your arm on the skin, which measures glucose continuously. So continuous glucose monitoring. And now we've just seen NHS allowing to have the artificial pancreas to be managed at home, for example. There's a new concept that's just been released by the NHS. COPD asthma, can we manage their peak flow monitors at home with real-time data capture and to ensure compliance, for example. We can capture that data now much more effectively. And we want to keep people away from the hospital. You know what? Patients also don't want to come to hospital, Greg. We always overestimate the need to come into hospital. They want to. So I think it's that smart conversation, Greg. And I think patients, now they're more empowered. They've seen they can be managed remotely and more able to understand that this is the way forward for the healthcare system. So technology is going to be a fundamental part to manage that burden of workload that we have in the healthcare system.
Just quickly to say, I actually also heard an amazing stat that apparently in Birmingham on a Monday to Friday 9 to 5, 1 in 4 taxi rides is a taxi ride to the hospital and back. So patients with chronic illnesses, patients. So think about the carbon impact as well of patients now no longer needing, the impact on their life, their experience, but also the carbon impact. If we take those taxi journeys off the road, what can it do for our cities, for our environment, for our health around it, cleaner cities, cleaner environment, so there's lots of opportunities now for us to take this technology and really begin to deliver those services at home.
Great. Thank you, Danny. Thank you, Shafi. I feel like we've barely scratched the surface. We could do this all over again. Thank you both for your time today so much and for sharing your insight. Absolutely fascinating to hear your views. If you've enjoyed today's session, please do check out other episodes of Wired Briefings at wired.co.uk. We are delighted to announce that Wired Health Tech is back, returning on September the 22nd. Speakers last year included Nobel laureate Jennifer Doudna, Heidi Larson from the Vaccine Confidence Project, and Indra Joshi, the Director of AI at NHSX. A final thank you to Danny and Shafi, and to all of you for joining us today. Thank you so much. Stay well, and we'll see you soon.